So welcome everyone. Welcome to our fellowship information session. I'm Peter Lovell and I'm Director of the NIHR Research Design Service here in London, and I'll be chairing the session today. For the first part of the session, we'll be sharing information with you through a series of talks. We'll start with an overview of the Academy funding opportunities, and today we're focusing on the postdoc schemes, so the Advanced and the Development and Skills Enhancements Awards. Two previously successful applicants will share their experiences of applying for a fellowship. You'll gain insights from a fellowship committee member, and also we'll outline the support that the NIHR can offer to fellowship applicants. We'll then regroup and have a Q&A session at the end, and we'll be rejoined by all the speakers from the day for that. Just a little bit of housekeeping to start with. We'll be recording this session and we'll be able to share that with you in a few days' time for you to refer back to. Please keep your microphones on mute during the presentations just to reduce the feedback. And you're very welcome to ask questions through the chat function in Teams, or if you'd like to raise your hand, we'll pick up as many questions as we can in the Q&A session. So within the invite, you'll have seen an outline of the programme today. We're running for about 2 hours. We're going to try and go straight through without a break and leave sufficient time at the end for Q&A. So without further ado, I'd like to introduce our first speaker of today, and that's Gareth O'Brien. Gareth is a senior program manager in the personal awards team at the Academy, and he's going to give us an overview of the advanced and DSE funding streams. Over to you, Gareth.
Thanks, Peter. Cool. I will share my screen and I'll get started. See that? Okay. Cool. Right. So. Thanks everyone for having me. As Peter said, I'm Gareth O'Brien. I'm a senior program manager in the personal awards team, and I look after our advanced fellowship as well as our new team science award. But in personal awards, we sort of work across all the schemes at certain levels. So I'm going to start off by just talking a little bit about the Academy, and then I'll go into the specifics of our postdoc awards and reveal something quite exciting about a development that we've had very recently in the development and skills enhancement offer. So first of all, this is a quick snapshot into who we are at the NIHR Academy. So our main role here is to develop and coordinate academic training, career development and research capacity development. And we do that by managing national competitions for training and career development awards. And all that is with the aim of attracting, training and supporting you guys as researchers to conduct leading edge research focused on the needs of service users and the public. And you'll see when I talk about our remit later that sort of public and patient benefit is the real thing that you need to sort of draw out in applications to the NIHR, especially for our fellowships. We do this really with the idea of developing the skills of the next generation. And when I talk about the next generation, I mean the next generation of people that are relevant to tackle these emerging health and care problems that we've got. So I'm going to move on to a really busy slide now, but what this shows you is sort of the breadth and depth of the offer. If you look across the bottom where it says postdoctoral, you'll see that the schemes that I'm going to talk about today, we've got 3 offers at advanced now that are dependent on the setting that you come from. And as well as that, I just wanted to draw your attention to some other areas of NIHR that you will be eligible for as postdoctoral people. So if you look under
You've switched to mute, Gareth, just to let you know. Gareth, you're on mute at the moment.
How long have I been on mute?
20 seconds, not long.
Okay. I have no idea how I did that because I couldn't even see the screen. So allow me to continue. Full screen. Yeah. Okay. All right, we can get over this awkwardness if I stop sharing, reshare, and just go from there. Right. Take two. So, as I was saying at some point, we've got a range of postdoctoral offers there across the bottom, and I wanted to draw your attention to the postdoctoral opportunities we have under other capacity building opportunities too. So we've recently launched a pre-application support fund, which will support people developing an application for any of our career development funding. And also the Team Science Campaign Award, which we've just finished the sort of first cycle for, also needs representation from people at a postdoctoral stage of their career. And that award is focused on bringing together teams to work in an interdisciplinary way to tackle some of the sort of key emerging health and care challenges that we've got. Generally speaking, because our offer is so broad, I think it's really important for you to consider the right award for you. So generally, you can do that by considering where you're at in your research career stage and the experience that you've had so far and your professional background. And now I'm going to talk about that in a little bit more detail, because your options generally lie between our research fellowships, which are open to all professional backgrounds, or our practitioner academic fellowships. And so across all of those programs, the best applications that we see describe sort of your level of experience and ambition that's relevant to the career stage that you're applying for, all of which have the sort of ultimate trajectory towards research leadership. Across all of our programs, we expect a bespoke plan for the research development skills that you'll develop over the course of the award, as well as the hosting arrangements that will sort of provide the opportunities for you to develop as a researcher. In addition to those, when you're applying for something under our integrated clinical academic pathway or one of our local authority schemes, you can also include your aspirations for career progression as a clinical or practitioner academic, a bespoke plan for your professional development as well as your researcher development. The hosting arrangement should cover your opportunities for development professionally as well as your opportunities for development in research. And we'd want to see a clear commitment from your hosts for your clinical practice and for your clinical practice time to support you to become that clinical practitioner academic that we want to see. In terms of our remit, it's incredibly broad, especially at postdoctoral level. Within our remit are things like early translational, clinical and applied health research, and social care research. As I said at the very start, what's really important is that the research that you apply for has got clear potential for directly benefiting patients, service users, care, and the public. But obviously, as these are fellowships, we recognise the training element of this research. If the work involves biomarkers, I suggest that you read the guidance notes. The guidance notes are very detailed with this. Generally speaking, research that tests whether application of neurological improved treatments is within remit, but research into biomarkers that aims to look at the mechanisms underpinning the disease or identify risk factors is out of remit. We also would love to fund more research into high quality educational and methodological research too. We don't support any basic science work or work involving animals or their tissue. And as I mentioned, biomarkers that elucidate sort of mechanisms underpin the disease are out of remit. So when you're looking at stuff around biomarkers, I would encourage you to, if the guidance notes isn't clear enough, just get in touch with us. We're super approachable. A conversation with us where you can explain your research in detail will give us that idea of whether it's within remit or not. And this impact on the patients and the public has got to be clear. That must come through at all stages. Generally speaking, we fund your salary. This is both for clinical and academic time, any conference attendance and research visit, including overseas travel if you're collaborating internationally. We fund the research costs, we fund the academic training costs, and we'll fund any professional training and development costs as well. It's a really flexible offer in that you can pick it up at increments of 5% between 50% and 100% whole-time equivalent. So what we want that to do is really support you where you're at in your current career and your circumstances. So there's sort of 44 different ways that you can splice an advanced fellowship in terms of the whole-time equivalent offer. And we're always up for a conversation about how we can best support you and what whole-time equivalent would be possible to allow you to conduct your fellowship as well as anything else that you've got going on in your career. I'm now going to talk about some of our specific awards at postdoc level, and I'm going to start with our Development and Skills Enhancement Award, which is aimed at supporting early to mid-career researchers to gain experience. And the difference between this and our standard fellowships is the DSE is mainly used to get you to the next phase of your research career. So we very recently changed the offer. This used to be a 12-month award. It's now available at 12, 18-month or 24-month durations, and again, between 50% and 100% whole-time equivalent. There's slight differentiations in what we can offer for funding here. It includes funding for salary, training and development conferences, as well as a fee for mentorship. And in terms of the eligibility criteria, you'll get familiar with this as I go through the presentation. The proposed host must be an English higher education institute, in this case for DSE, NHS body or other provider of health and care services. And you've got to hold your relevant PhD or MD or have submitted your thesis at the time of application with a view to it being accepted and complete by the time that you start. In terms of the assessment criteria for the DSE, it's about that trajectory to become a future leader, commitment to health and care research, but mainly for the DSE, I think what the selection committee are really looking for is the clear plan for how the award will support funding, support future funding within our remit. So what's next after the DSE and what's going to help you get there? So when you're considering putting your application in and you're looking at your training and development and you're looking at what you want to do over the 12, 18 or 24 months, it really is sort of that transition between where you are now, what it is that you're doing at the moment and where you want to be at the end and how that will help you get to put in an application for future funding. Obviously, we do look at the quality and relevance of the training and development in isolation, but it really is using this award as a vehicle to help you get to the next stage of your career. This one's open all year. So you can apply through our awards management system at any time, but it'll be selected into 3 pots where we review in June, August and February. This is the exciting part of the presentation because I can announce that we've got a new element of the DSE available, which is the Cancer Research Transatlantic DSE. So these awards are jointly funded by ourselves, the MRC and the National Cancer Institute in America, and provide an opportunity for UK cancer researchers to spend 12 months at a US-based institution looking at cancer research. So here you've got to be located in the UK. It's not specific to institutions in England, but in terms of where you're at in your career, that relevant PhD or MD is the same. This is a 6 to 12-month award to fund visits to the research groups out in the States. We also fund travel and relocation costs, as well as for yourself and for any members of the family that would travel with you, as well as health insurance. And the assessment criteria here is very similar, but it's much more related to the collaboration with the institute in the States and the what you'll gain through taking through going to that travel and bring back to what's relevant to the UK. The deadline for this is the 1st of December 2023. Conscious of time, so I will start to whistle through these a little bit now. This is the process for the applying for a DSE, so there's an application window. The difference between this one and what you'll see at our advanced level is there's no peer review and there's no interview. So it's just based on the application, which is then reviewed by our committee, who then shortlist and then make recommendations for funding. This is about a 12-month process that you can see from the application window to the award starting, generally speaking here. Now I'm going to talk about the fellowships that we have on offer at our advanced level. These are fellowships designed to support you at the sort of early postdoc career, whether you're establishing your independence or whether you're already established independence, but you're not yet a research leader in the field, or whether you're transitioning from basic science into more applied health and care research or returning from a substantial career break. And we break up the postdoctoral offer into sort of 5 semi-distinct areas. and they're really based on what you expect to achieve through the fellowship. So I'll outline some of the detail in the next slide. So in terms of our clinical and practitioner academic pathway, this was developed to replace our old clinical lectureship and senior clinical lectureship. And this is open to health and social care professionals registered with one of the approved regulatory bodies, except doctors and dentists. And the difference between this and an advanced fellowship is between 20 and 40% of the award must be dedicated to the development of your clinical service or practice role, which is funded through the fellowship. This launches twice every year in April and October. And that bit there around the professional bodies that you're eligible to be part of and the development of clinical service or practice is the difference between this and our advanced fellowship. There's a very similar offer, which is our advanced local authority fellowship that matches the ACAF, but is available to people based in local authority settings. And I asked the team yesterday what the sort of unique selling point was at this award. And it's the opportunity to connect with people who are having experiences in a similar setting to yourselves. So whereas the advanced fellowship is available to anyone from regardless of your professional background, this one is much more targeted at local authority settings and sort of a cohort of people developing research in that background. Our AF is open to all professional backgrounds with the option of up to 40% clinical practice time. Very similar in terms of the support that it offers. It can be between 2 to 5 years with a whole time equivalent between 50 and 100%. And you can also apply for 2 sequential fellowships up to a total of 8 years. And this recognises the sort of postdoctoral journey from being an early postdoc researcher to then taking it on a bit later in a more senior postdoc role. We also have the EME-AF, which is based through a collaboration with a different part of the NIHR. It's assessed by a joint committee of members from both the efficacy and mechanism evaluation and the advanced fellowship, and this is to gain experience of leading a clinical study. It's funded in a very similar way, it's assessed in a very similar way, it's just a slightly different offer at postdoctoral level, and it's about the development and gaining experience of leading one of those clinical studies. Conscious of time, so I really will speed up now. We also have a Population Health Career Scientist Award, and this is to develop expertise in areas affecting population health and develop expertise in public health leadership. So this is a UK-wide initiative focused on the wider determinants of health, and it includes a sort of shout out to other professions that are not typical applicants for us. So environmental science, mathematics, architecture, and all the other ones listed there. The eligibility criteria for all of those is to, apart from the population specific ones like the local authority, is your proposed host must be based in the UK or one of the developed nations that's participating. The point of your career must be after you've had a PhD. You must have been awarded your PhD by the time that you attend interview, and you cannot hold a chair at the point of application. For any clinical applicants, we expect that you will have completed your relevant pre-registration training too. As I outlined, the main difference in the process is the fact that at advanced postdoc level, we put it through peer review, and this is to make sure that your research is given an overview by experts in the field, and they can inform our questions at interview so that we can really delve deep into whether your research is fit for purpose as a vehicle to take you to where you want to be when you finish your award. We look at 5 different assessment criteria when we consider postdoctoral applications. And those are yourself as a person, as a researcher. Is the trajectory relevant to your career stage and background? Is your project a high quality research program? In terms of place, is your support from your mentorship team and host organization suitable for what you've proposed? This is not reputation based on the organization or the names of the mentorship team. It really is about the bespoke support and what they'll provide to you in terms of taking you through your fellowship. Your training needs to be well thought out, bespoke and relevant to you. So if you have a particular element of health economics or statistics that you've not covered before, we would expect to see that reflected in your training package to help you develop those skills to undertake your research. And we also assess PPI, and this is done by our pool of public contributors who will look at your plain English summary, but as well, they'll look at your patient and public involvement plan and make sure it's inclusive and integrated to the project. In terms of the pre-application advice that we can offer you, I think it's really important to understand that that applications like this take time. So to understand the timescales, understand the process that you'll be put through, and understand our remit. If you've got any concerns with any of that stuff, please just get in touch with us. We're a really approachable team. One of the best things we can do is have conversations. It's always heartbreaking to get through to shortlisting or eligibility checking and find an application that so much work has gone into and it falls at the first hurdle because it's out of our remit. In terms of areas to improve, remit is one of those. Make sure that it fits in with what we're talking about. In terms of the research questions themselves, they might not be clear. It might not feel like your project. We sometimes get applications that feel like an extension of your supervisor's work. They're not necessarily looked upon particularly well by the committee. Again, mentioning support, training, making sure it's relevant to you. We will look at value for money. We are aware that fellowships are becoming more expensive as costs increase, but we will have a look as whether you've justified the resources that you've asked for. And PPI is becoming an increasing area of concern for us. I think we now understand PPI a lot more, so we can recognise what a great application looks like to maybe one that hasn't been thought through as well as others. I really want to call out very quickly that we offer partnership fellowships. So we partner with charities. These are jointly funded between ourselves and our charity partners. And while it doesn't necessarily give you an advantage to apply for a charity in terms of your chance of being funded, what it does offer you is the benefits and opportunities of cross-sector working and insights into that population of specific people. The partnerships around specific change round by round, and that'll be reflected in the guidance notes. So you can have a look who will be partnering with us for round 11, which will open in October. In terms of if you're unsuccessful, can you apply again? Generally speaking, you can apply to a scheme on one further occasion, but there are rare occurrences where you may have been deemed fundable, but the budget doesn't cover a fellowship. That will not count as an unsuccessful application, so you'll be able to apply again under those circumstances. The next slide just covers some additional resources that you can go into to learn more about all of the fellowship programs, any of our funding opportunities, to signpost towards other webinars and events that we've got on, and there's some stuff in there around patient and public engagement and involvement too. So thank you very much for listening. I know that's a huge amount of information to take in. The main things that I want you to take away from this is there's probably an award that suits you and your circumstances, and if you don't feel like there is one, please get in contact with us and we can discuss what would be best for you. In terms of any queries that you've got around whether your research is in remit, whether your research could be funded by the NIHR, that again, I encourage you to reach out, get in touch with our team. We're super friendly, we're really approachable. So thank you very much for listening. I hope that was helpful. Sorry for the minor 20 seconds of silence in the middle of it, but that's all from me today. Thanks.
Thank you. Thanks very much, Gareth. That was a great overview. If that has raised questions, then we can take them in the Q&A at the end, or if you'd like to start putting those in the chat now, we can start answering those as we go through. Thanks, Gareth. We're perfectly on time. I'd now like to introduce our second speaker, Kate Bramman. Kate's a reader of nephrology and maternal medicine at King's and is a consultant nephrologist. Kate's been awarded an advanced fellowship, and she's going to tell us about her experience of developing and getting the award. So over to you, Kate.
Thank you. I'm having technical issues, you've probably gathered. I can't seem to open my presentation at the moment, so it's good that I sent it over last night. I don't know if you can access it, but I'm very happy to to chat without slides if that ends up working. But I guess just to sort of kick off by giving a bit of background about me, I trained in Oxford and then in London, and then was a South Thames trainee with nephrology, but then sort of developed a bit of a taste for obstetrics alongside. And I initially, my kind of academic journey started with a sort of false start. I got shortlisted for an MRC study, a PhD, and suddenly at the final hurdle realised that I really didn't want to do basic science. So that was kind of a key learning point for me, that kind of needed to think through very carefully kind of what my research vision was. And then I kind of backtracked and did 4 PhD applications in total. I got one of the first BRC fellowships. Oh, thank you, it's amazing. one of the first BRC clinical fellowships, and then finally was successful and got an NIHR fellowship, doctoral fellowship, working with Lucy Chappell, who I think probably most people now know. I was her first PhD student. And then sort of limped along with sort of part-time training alongside trying to find bits of chunks of money alongside to carry on with my sort of research activities prior to kind of getting a consultant post. So sort of a list of various different opportunities there. The Chadbourn Lectureship was a fantastic kind of provision within KCL for part-time researchers. And then the King's Prize Fellowship continues, so I had that for a year, and then I had a sort of chunks of money that were kind of kindly offered to me by various different kind senior researchers. And during that time, I kind of muddled along and did an application to the NIHR for clinician scientists, which was kind of the awards system then, and didn't get to interview. And then I applied for postdoctoral NIHR fellowship and didn't get to interview again, and got very interesting feedback. And the feedback was kind of around the sort of niche area that at that point I was really focusing on, which was obstetric nephrology, so women with kidney disease who were becoming pregnant. And actually, as I've kind of my research journey has evolved, I've kind of become increasingly to learn that the numbers of women that are affected are much lower than we previously anticipated. And I can really look back and think, well, I kind of understand why the NIHR didn't want to invest resource there, because of the relatively low impact potentially, although kind of an important area in my mind. I then managed to be successful and got 3 Kidney Research UK grants, which actually included quite a lot of work from these fellowships. And unfortunately, because I got those grants, I was no longer eligible for the Wellcome Fellowship that I did get shortlisted for an interview. So it was a bit of a tricky time. So I ended up having 3 years delivering these research grants without a fellowship. But then it's a good time really to reflect and decide really which direction I wanted my research to go. And I actually sort of went back to the drawing board and thought about what my passions were, what key areas were that I wanted to develop, and also what my kind of previous experience strengths were, and which people that I wanted to work with in the future. So next slide, please. This was kind of like my CV at the time of my application. I had various different kind of fun grants that I'd achieved, and I was also starting to supervise and had a reasonable number of peer-reviewed manuscripts, but didn't have any kind of big smashing kind of Lancet or New England Journal papers by any means. And particularly, I think, she says as an excuse, I was kind of working in a very niche area that's kind of quite hard to publish in high impact journals, but so I didn't have a huge amount of fantastic track record, but certainly I was sort of on the path, and I was starting to supervise some postdocs. Next slide, please. Thanks, Peter. Just kind of a little bit of what I've done in the past. It's quite a mixed bag, and you kind of hopefully see how it all comes together. I started out with this part of my PhD, this prospective study, which was called Up Higher, and very quickly I had to change the name because the midwives told me that sounded like a vaginal examination. So it started out as Up Higher and then became Peaches a bit further down the line. So I was interested in kind of urinary biomarkers. Next slide, please. And we found a biomarker that was kind of interesting, and then everybody else found it at the same time. Alpha-1 antitrypsin. Next slide, please. And then amazingly, this got picked up by a commercial company who developed it as a urine test for preeclampsia in low-income settings. So we sort of started to move that forward, and that really kind of whetted my appetite in terms of kind of thinking about global health, but also how we can use global health in a UK setting, particularly in South East London, where we've got a very diverse population, and kind of utilise South-North learning what I knew from working with sub-Saharan African teams to kind of deliver better care and research activity for women in the UK. Next slide, please. And I kind of became increasingly interested in the role of point of care testing and immediate impacts for patients, and also kind of the ability to generate data for people at home. Next slide, please. Oh, clearly my slides are too heavy. I'm trying to remember the next one, but so other sort of key areas that I've developed over the last few years has been also kind of developing an interest in early disease prevention. So disease prevention, kidney disease, but also kind of cardiometabolic risk factors. And I've been working with the London Kidney Network to try to, as part of my clinical role, to try to introduce a new medication which has the, I mean, it's extraordinary, has the potential to kind of really change the trajectory of kidney disease. It slows down the progression. It also reverses cardiac dysfunction, controls blood pressure, prevents diabetes. It's called dapagliflozin, or the SGLT2 inhibitors. Whilst I was kind of utilising, sort of learning about this new field, we also did a lot of PPI work, working with local Afro-Caribbean communities, kind of understanding what their unmet needs were. And we developed a program called Hidden, where we've kind of worked with peer educators to deliver healthcare in community settings. And that's kind of another key part of how my fellowship has evolved. So we trained peer educators to be the kind of intermediary kind of workforce who are able to engage with communities, underserved communities that don't normally have access as we see it to healthcare services because of mistrust, because of logistical issues, because of awareness. And that was kind of extraordinarily interesting and something that I've become increasingly passionate about, utilising that approach for future research. In addition, I'm particularly interested in utilising pregnancy as an opportunity to identify future disease. So it's sort of a real stress test. It's this sort of golden window when you've got people actually coming through the door for a different purpose, albeit, but actually being able to find people with very early disease. And my kind of vision was that actually, this is kind of a far bigger pool of people to impact and benefit than just my kidney disease and pregnancy issues. So actually using pregnancy to identify people with future risk and using this new medication to potentially reduce that risk of cardiometabolic disease, and using a different approach to access people from underserved communities, using this peer educator approach that I described as part of our kind of community engagement. So I sort of sat down and kind of thought about all these different kind of strands and point of care testing as well, different strands. And it kind of, the timing was kind of very fortuitous, I think, with the pandemic, etc. And really that spotlight being put onto the needs of underserved communities and trying to deliver research to meet their needs and to co-develop research with these people that have had difficulty being represented in clinical trials before. So kind of thought, postpartum women, they never manage to get recruited to clinical trials because nobody dares go near them with a new drug. It's extremely difficult for them to get to hospital when they've got a small child, and also really trying to kind of access different communities with socioeconomic deprivation and different ethnicities. So I did a huge amount of PPI, and I think that really felt to me like the golden ticket. And it wasn't a tick box exercise. It actually really genuinely did kind of help redefine what my priorities were and how I was going to deliver the work in the fellowship. And so I kind of approached, I had already got some contacts, but approached various different community organisations within the local community, and then also reached out to socioeconomically deprived communities in coastal Kent. And that was kind of, I think, one of the key parts of my success, in that I kind of really thought more widely rather than just kind of in our patch, thinking about how to generalise these findings for different underserved communities in the UK. I mean, I think there's a bit of a nuance around, just lumping everybody together, and one of the kind of approaches that I'm really trying to develop is making bespoke packages that to meet the needs of those different underserved communities, but using kind of a core toolkit. The other thing that I did in terms of PPI was also I approached the ARC public panel, and that was extraordinarily interesting. Their feedback was invaluable, and that kind of really changed my direction in many ways as to what I was hoping to achieve. And they also kind of pulled in a thread around mental health for me, which I hadn't really thought about before, but kind of trying to make sure that those particular needs were met alongside the other kind of cardiometabolic, kind of kidney related stuff that I'd originally focused on. And finally, again, one of the really kind of important insights that I got was really just having conversations with women themselves, who would never ever engage with the PPI group because they haven't got time, because they haven't got the confidence. And so these really truly unheard voices I was kind of accessing, and I think that was, again, really important, but also kind of added weight to my fellowship application. So by the end of it, and when I've kind of pulled all these strands together, I've kind of developed a feasibility study, which is going to be using this new magic drug to reduce cardiovascular risk factors in women, postpartum women, but using a peer educator approach to keep having regular check-ins and support them. So kind of a key person from their communities to be able to keep them engaged with the study. And also, one of the brilliant ideas that was given by one of the PPI team was actually having somebody called a study buddy, so another friend or family member to be able to join the study in parallel with them, to be able to take part, and we kind of have key learnings from that methodology as well. All the study activities will be supported at home with finger prick, urine test, etc., and they've only got 2 visits where they need to come up to the hospital. So fantastic! I'm so delighted that I'm kind of been funded. The other key bits to the fellowship application are obviously around training, and one of my mentors said to me, look, you've got these things on your list, and yeah, they're fine, but actually what the NIHR want to do is to support you to become the best in the world. This isn't just about the UK. Have a look, see who is doing this work in other parts globally, and go to the best of the best. And that's what I did. And so I identified the most amazing woman in Canada, in Vancouver, Dear 11, who I just reached out to, and as part of the fellowship, I've got a placement there, working with their team who are doing sort of similar work, but in a slightly different, with a different scope. Working with a group in Amsterdam as well, who are kind of doing similar work with migrants. And so that was kind of really useful to just sort of have a bigger picture thought about, nothing's impossible, and to kind of really map that out and put that in. In terms of the sort of mentorships that I chose, I kind of went very diverse, rather than using people that I'd worked with before that I knew that I could always still have access to in terms of their kind of expertise. I approached people who had very different skill sets. So I've got somebody from primary care who is superb and kind of working in a different space slightly, and also a kind of cardiovascular nephrologist. Again, I suppose a bit of overlap, but a kind of somebody that's got a lot of clinical trials experience. And then finally, an expert midwife who had kind of experience in kind of engaging women and interested in that sort of postpartum space. So very different skill sets, again, kind of in terms of kind of being able to input into my fellowship. And the other thing that I did was I tried to weave and pull in as much as possible of different other NIHR activities. So kind of I vaguely kept my finger on the pulse and sort of knew who was doing what elsewhere in the UK, and tried to sort of pull in how I could potentially work with them in the future, or how my work could contribute to their output, etc. And kind of thinking about the NIHR as sort of a bigger infrastructure network kind of family, if you like, how this resource needs to be used efficiently, and so we can all kind of feed into each other's work in a collaborative way rather than a competitive way. So I think those were sort of the key ingredients that seem to kind of tick the boxes this time, rather than sort of bashing on the same door with the sort of niche area that I'd previously been looking at. And I think, again, the underserved communities was a key priority, and again, something that I feel very passionate about, but also having kind of a big impact on a larger number of people. I think felt like those are the key factors that made me successful this time. I think that's it. Hopefully I've covered most of the content in my slides. Sorry I haven't had any pictures and you've just had me waffling on, but hopefully that was helpful, and I'm very happy to take questions later.
Thank you. Thanks very much, Kate. Thanks for sharing your story and giving us those insights. And it'd be great if you could join the Q&A at the end. Thank you. Sorry for the technical hiccups there. Great. Our next talk is one that we recorded in March 2022, and Polly Livermore gave us some really useful insights into the preparation of her DSE award. We'd like to share that with you now, and we feel those insights are still very relevant. So if I can ask Catherine to share that recording with us now. Here we go. Thank you.
Today. So thank you very much, RDS, for inviting me to come and talk to you today. My name is Dr. Polly Livermore. I have a number of hats at the moment. I'm a rheumatology matron at Great Ormond Street Children's Hospital. I'm also the BRC Clinical Academic Programme Lead, which I'll touch on, and I hold a current NIHR Development and Skills Enhancement Award. So I was asked to come and talk today about my journey and give you some hints and tips. So this is kind of a schema really, which just shows my journey, and this fits very nicely with some of the comments some of the audience today put in the chat about the journey ahead and how kind of scary and daunting it can be for many different reasons. So I've been a rheumatology nurse since 1997 in a variety of different roles as a research nurse, a nurse on a ward, an advanced nurse practitioner, and then I kind of hit a ceiling really and ended up going into management and became a kind of rheumatology matron, trying to keep my clinical hand in. But throughout that time, I knew I wanted to do a PhD. It's been something I've wanted to do for many years. So I applied to the NIHR to do a clinical doctoral research fellowship. And as you can see, I applied in May 16, and that was awarded in December. So that took a good 6 months or so before I heard about that. And then I started my PhD award. So that originally was 3 years full time, but 2 years into that, I was offered the clinical academic program lead role at GOSH. So what I do in that time is I run the internship program. So I teach about research for nurses and allied health professionals across the trust, and specifically what applying for fellowship involves and what kind of things the NIHR in particular is looking for. And so when I had to then slow down my PhD because obviously I was working half time. And then I returned to the matron role in September 2020. So thinking about kind of my future and where I could go, at the time, I didn't feel ready to put in a clinical lectureship application. I wanted to have a little bit of time to really make a good application. So the Development and Skills Enhancement Award was absolutely perfect for me. And just a couple of things to highlight, you can see how many less words it was. So it was 35 words instead of the 67 that the PhD application needed for me. And also the time kind of difference. So I applied in the August rounds and I heard in October. So it was much quicker from before the previous May to December. And so I got my DSE award, which was fabulous, and I started that this January. And I've started at half time with my clinical academic lead role. And the reason for that is because I'm already have teaching programs set up, and I have a commitment that I felt would be really hard to let the clinical services down. So I stepped out of the matron role to do this. Also, just to highlight, which I'll touch on in a bit, is I did also apply for the RDS EPIE award, successful at that. And all of this is working together to go ahead for what would have been previously the clinical lectureship, but now the ACAF, as you've just heard, and hopefully with an application this June. So just to give you a little bit of what my understanding of the key remit for the development and skills was. So as I've got the old picture, I'm not as clever as Tom and haven't changed mine, but it was this green bit here that I was applying for as an early postdoc. And the understanding was that it was for current or previous members of the NIHR Academy. So it was someone who had to be in the NIHR over the last year. So that immediately narrows down how many people are going to apply for it, which is great in many ways. And you, as we've heard, you have to really show how this application will help you succeed at next steps. And that was fine for me because I was quite clear in where I was going, where I hope I'm going anyway. And the maximum funded award length was for a year. And I will tell you a little bit what I applied for in a minute, but it was for a year. As we've heard, there's numerous rounds, and that was absolutely fabulous. I had a rocky road last year with a couple of bereavements, close family bereavements, and that meant I missed the round I was actually going for. But that was fine because there was another round coming around pretty quickly. The matched funding was sticky for me, as I think it is sticky for most people, and I will touch on that, but I had to think creatively. I am a clinical nurse by background, and my clinical team wanted me to do nursing. They had released me for 3 years to go off and do my PhD, and they wanted me back. And actually it was really hard to justify and to explain and to get them to understand what's really involved. So I'll touch on that. And as we've heard, the training plan is key. This is a training award, a development and skills about what you need to do the next step. So for me, this is just one slide about what my award was about. So I applied for 1 year salary. I was applying for half time. So I was applying for the matron bit of my role to run for all of this year. I was originally supposed to start last December, but the clinical team wouldn't let me go. So I've started this January for a year. And what I needed to do when I was thinking about my gaps in particular, so I had done a scoping review as part of my PhD, and now as a PhD supervisor, I'm supervising students who are doing systematic reviews and hoping to do a systematic review in my ACAF in the future. So it was really important that I got a good grounding in that. My ACAF is about bringing in an intervention for children and young people with rheumatology conditions. So I wanted some really strong intervention development so that I could put a really strong application in with hitting all the bits that I needed to hit. And then obviously when you've got an intervention, you need to work out how to implement it and how to make it sustainable in the NHS and think about all the things you need to think about with costings, etc. So I've got some implementation science as part of my training. And what was really important to me was making this project co-design. And so I've done a fabulous course on evidence-based co-design so far, and that will really help me put a really strong application in. The NIHR also love visits. They love for you to show how you're going to become an all-rounder and develop all areas of yourself. And using a visit is actually a really good way of showing your clinical kind of development and learning from other centres. So as you can see there, I've got a couple of visits that were appropriate to the project I was putting in for. And then conferences. So you still get conference attendance and you get some funds for that. So for me, it was important that I go to the mental health conference in Australia, which was also a co-design conference. And I'm hoping to present at the Paediatric Rheumatology European Society meeting. And all of that will come together for my ACAF application. You can see there some of my research supports, obviously not supervisors at this level, but people that are really going to support and champion you through. And for me, my project is really heavily working with the charity partnerships, and that's something that I've been doing a lot on at the moment, and you can see there the charities that have agreed to help me. So the development skills application, as I've already said, is a lot less than when you previously, if you did apply for the CDRF or equivalent through the NIHR. So the main bits of your application is you have a chunk, 1,000 words on your research background and 1,000 words on your training and development. So while it might sound quite simple, it's actually really hard to get everything you need into those 1,000 words. But yeah. So one of the things the NIHR we're always told their weighting is based very much on person, place and project, so a third in each of these areas. And what they are, so for example, you can be a really strong person, you could have had loads of publications, loads of dissemination, you could have done an absolutely amazing PhD project and be all singing and all dancing, a really great clinical expert. But if your project that you're proposing isn't particularly strong, then potentially you run the risk of falling down. You need to be strong in each of those 3 areas. However, maybe the new NIHR weighting that I've heard about is a quarter for person, place, project and PPIE. So really making strong your PPIE input into your project. And obviously your application will be assessed by lay members and PPIE members. So it's really important that that is really thought about as you go through. But actually my NIHR weighting, and this is what I would give it, is about your person, your place, your project, your PPIE, but it's also about the people around you, and it's also about your passion. And I'm going to touch on each of those in a minute and why I think they're important. So thinking about the person in particular, so we all come to this as a clinical expert. We are really at the top of our field about where we are, where we've been, what we've done. And often for these, especially for, I know for the ICA programme for nurses and AHPs, we often come along that bit older. We've had many years working clinically and actually now we want to develop it academically. So we could write pages and pages on our clinical skills, I'm sure. But thinking about our leadership, we also, because we're so senior generally in our clinical areas, we are leaders. We often lead teams, we lead people. We have quite a good grounding in leadership and about all of the skills that brings with it. Our research skills and experience, as we've already said, you have to have done a PhD for when you apply for this. So we have a good knowledge of research skills. So for me, I'm a hermeneutic phenomenologist. I love phenomenology and qualitative research. Are you going to continue along that path as you go forward and be a complete expert in that field? Or are you going to branch out and develop your skills into other areas and learn from other things? What about your extracurricular activities? For me, I've been on the RCN Rheumatology Forum for 6 years. I'm on the British Society of Rheumatology Committee. I'm an associate editor for a UK journal, and I'm on the editorial panel for an international journal. All of those things you need to put into that 1,000 words about all the fabulous things you do in your own time and how you are not just partaking in those things, but actually how you're leading and championing and changing things. What about your international profile? That's really important. The NIHR want people who can talk about work with international different people, learn from what is happening outside the UK. Obviously, the NIHR's focus is on the NHS and what's happening for the UK, but it's also learning from what else is happening. What about dissemination? And I'm not just talking publications here, but it's about proven dissemination. So have you done webinars? What kind of videos have you done for patients? What events have you been part of? PPIE work, for instance. So thinking about all of your dissemination. And what about your publications? So I'm a nurse, as I've said, my H index isn't particularly high, but I have tried really hard over the last couple of years. And this is a bit of an old slide. I've added some new things in there, but it's not just about the high impact publications, but other things that you might have done. So writing guidance documents, writing policy documents, doing chapters for publications, chapters for books, those kind of things. Also conference presentations. Where have you done conference presentations? Have they been invited speakers? Have they been international? What did they involve? How did they lead to other things? Did you then disseminate in written format after your presentations? And deliverables, so delivering on time. Did you get your PhD done on time? Have you done things on time as you set out to do? Are you someone who is proven to deliver, and you can show that? Thinking about any awards that you might have got, these might have been research awards, these might be best practice, best posters. I recently got an award at GOSH and I was the best lay summary for an adolescent symposium and a best poster presentation. So all of that again needs to go in there because that shows how you can deliver on these things. Thinking about grants as well, what kind of grants might you have achieved? As I said, I recently applied for the RDS PPIE, the PIF fund that they do, and that's a small grant for £350, but actually it's really important, and that grant will go a very long way in helping to remunerate patients and partner groups who are helping me with my work, but also applying for travel grants, applying for conference scholarships, those kind of things. I've recently been, I'm a co-I on an Australian grant, and that's for 77,000. So you might be on all kinds of different things. Make sure you justify and put them on there. Supervision and mentorship is really important. MSc students, but also PhD students, and what's your role with them as we kind of increase that as we become more experienced as a postdoc researcher. And all of that works together with your personal qualities, which obviously you are demonstrating through all of the things you're describing here. Thinking about time management, good communication, those kind of things. So then looking at your project, so this is really hard for the development and skills because it's about a training plan. So it's about what is specific to you, where are your gaps, what do you need to do, and what are the best courses for you to do. So I wanted to do, as I've said, the intervention development. There's lots of intervention courses out there. I really looked really hard to the one that would give me the best and give me the best training. Visits and shadowing and network, as I've said, think outside the box, think where you can go, what will add to you in your clinical and you bring back. And your conferences as well. I mean, you might want to use the VTI framework so you can plan all of this and you can show where your gaps are and what you need in particular and why it needs to be funded going forward. So it's the what and the why. And you need to justify that funding. So this is the funding that you get for the Development and Skills Award. So don't go over these, but think about how you can, how everything works together and adds up. But it's really hard because you're also talking about your long-term project, although you haven't got space to talk about that. But you need to talk about your patient benefit and why you need to do this, because if your patient benefit isn't strong, then there's no point in NIHR paying for you to do a really good training plan if your project later on doesn't lead to improvement in patient care. This might be progression from your PhD work, it generally is, and from where your expert knowledge is. And as NIHR projects, generally, they're your project. This is your passion, this is what you want to do and why it's important. And what's the need? Why do you need to do it? Why do they need to fund you? And then these things here are really important, and there isn't always an answer. But what about your timing? When are you going to start? When are you going to finish? What are you going to do when? Is your project too big or might it be too small? Is it feasible and is it realistic? So think about those. Briefly moving on to the place. So they're looking at the academic and your trust together and how they work in partnership. So this is looking at your support and your investment in you, and how are they going to support you to do that? As I said, my trust wanted me to work clinically, and I've had to have a bit of a fight to get to where I am at the moment. But you need to show all of that. You need to show that you're at the best place. And what early career researcher support do they offer you? So, for example, I'm one of the junior faculty co-leads at Great Ormond Street and at the UCL. And there's some really great early career researcher groups that happen and really a great teaching. You might want to look at the stats of your academic institution and how many complete into PhD and post-PhD. And all of that comes together in your kind of host statement that we've talked about, and that needs to be really strong. Match funding was particularly hard for me. I had to think outside the box a little bit about how I was going to get this. My trust struggled very hard to understand the process and how it relates together. And there aren't many role models out there. There aren't many people who forged this path. And so you have to think a little bit creatively. And I did go to some charities as well for a bit of a hand of this, but I got 100% matched funding in the end from thinking outside the box. So PPIE, as I've said, is really important, and thinking about what have you done so far and what has changed from your PPIE. So what suggestions have they come up with? What things have you adapted from what they've suggested to you? And then how will you engage with them going forward is really important. Is it going to be virtual, for instance, or face-to-face? We know that a lot of PPIE patients are asking for more stuff face-to-face now. They're sick of all this virtual world. And what is realistic that you're asking your patients to do? And is it really true PPIE? Are they really getting involved and engaged in what you're doing, or are you just telling them? You need to really show that you're taking it seriously with them and think about their compensation, their remuneration and their training. There's also help with LACE summary options, and the RDS is very good at doing that, but also putting your LACE summaries, you don't need them for the development and skills, but for later fellowships for your family and friends and asking them. So for me, I'm doing a co-design study, hopefully in my ACAF. So I am currently working with a very large group of young people and different parents. And so the PIF funding that I applied for has been absolutely fabulous to enable me to really thank those families for their time and their engagement and really show them that I value what they're doing with me. So most of you will know this, but moving forward into postdoc world, you don't have supervisors anymore. They're research supports. But thinking about your progression from your PhD, and this is really important. I was told when I went and visited Toronto in my CDRF that you need to show that you can go at this alone, but you are making the decisions yourself. You may well want a mix of professions. I'm a nurse by background, but as I've said, there's not many nurse role models. So who are you going to look for? And what about different methodologies? You need different people with bring different hats to you, and maybe some of those are international hats. Maybe you have people who got NIHR hats. Are you looking for the best people in their fields? Have you really gone outside the box and thinking outside your institution rather than just people that down the end of the corridor? But equally, if you're thinking outside the box and you have people all over the world, how are they realistically going to work together? How are you going to get people together so they can really support you? Thinking about mentors and collaborators is really important. And as I've said, I'm working really closely with the charities, so involve them. They're often really interested and really excited by our projects. You might also have a PPIE steering group guiding you, and you also might want previous healthcare professionals from the ICA scheme because they've been there and done that before you. So my last one that I think is really important is passion. And I think this is really, really important, and it's often really underrated. Chances are you have lots of passion and you're here for starters. So that's really good, but you need to be able to really show it and demonstrate it. This is not a time for imposter syndrome. You've really got to really so my top tips, this is my last slide, and I think it's really important with your RDS support. So the Research Design Service has been fabulous with me. Elaine Kingwell in particular has really supported me all the way through, and I really suggest you speak to them and you get them on board. You start planning early, you talk to them and go to all the fabulous things they offer and help. They are the experts in what you're trying to do. Talk to people around you, talk to your line manager, your head of department, your academic head, talk to anybody who will listen to you basically, and get real engagement really early on. But also, what can you be doing now? You've got some time. Could you be doing that abstract? Could you be doing that publication? Would that put you a bit higher up the ladder? Thinking about your PPIE, as I've said, and also writing everything down. I write everything down because I forget things. Any kind of conversation you throw is really important to me, and I've gone back to those so many times. Find your number one fan. We all have them out there, and look after them in return, because they're going to be the person that when you're struggling that you go to, and they pick you back up and put you back on that track again. Thinking about your elevator speech is really important. What do you want to do and why? Why you? Just in a nutshell, just you've got 3 minutes. Tell me why I need to give you $250,000 to do what you want to do. Involve finance early, as you've heard, is so important. Get them on board, really make sure they're happy with your costings, because you don't want to fall down at the last hurdle. And as I've said, be passionate and believe in yourself. It's not going to be easy, but it will be well worth it. So that's it from me. So thank you ever so much for listening, and good luck.
Hope you all found that useful. So that was the recording from March 22, and we will be able to pass that on as well as part of today's presentation. So it looks like we're perfectly on time, and there's been loads of questions coming in through the chat, so keep them coming. We're going to move straight on. Our next speaker is Jane Sandel. Jane's a Professor of Social Science and Women's Health at KCL. And we've asked Jane to join us today to share her experiences of sitting on the fellowship interview panel and give us some insights into what they look for in applications and at interviews. So I'm going to hand straight over to Jane. Thanks for joining us today.
Hi, Peter. Thank you. Can you hear me okay?
We can.
Good, good, good. So I am going to share my presentation. See if I can find the right one. On a tiny screen here. Right, my PowerPoint slide. There we go. Can you see that?
I can indeed.
Is it full screen?
Not yet, but I'm sure it'll come in a minute.
There.
There we go. Thank you.
Okay. So I've been on the fellowship, advanced fellowship panel 4 years. I'm also an NIHR senior investigator emerita, and have been involved with the NIHR incubator for nursing and midwifery, and also working with the academy team and the director of nursing and midwifery at NIHR on improved opportunities for health and social care professions, which comes under this amazing new £30 million a year for these groups. So I've been asked to talk about what that all looks for. And I thought it was just worth reminding you about the Advanced Fellowship Programme. So these are available for anyone from any discipline, and can also include healthcare professionals. So these are the awards that you're going for postdoc. They're an amazing opportunity. And the key take-home point from a panel member point of view is for you to remember this is the investment in you rather than the application for a research project. And a lot of people don't pay enough attention to the training and mentorship and focus a lot of attention on the project. Let's move along. So I wanted to, these change every year a little. So key point 2, look at the NIHR website. So they are people who have soon to be completing a PhD can apply, but they're available for people right the way up the career ladder, but not professors. And the assessment is based on the stage of your career. So you're not competing. If you're an early career researcher, you're not competing with someone who has a longer track record. It's the expectations of you at the stage in your career, taking into account any career breaks you've had as well. If people who are wanting to move from one field to another, if people who are wanting to re-establish their career, they're for 2 to 5 years, they can be taken part-time. And I think it's important to say that if you're a clinician, you can still apply for these. They're different to the clinical fellowships. You can have 40% of time dedicated to clinical professional development, or some people do a fellow fellowship part-time, and then the other part of their time they're working clinically. So I think that's an important point. So what are we looking for of the person? Because when Bartlett assesses these, there are points for the person, points for the project, points for the training institution, and there's a PBI assessment as well. So it is important to have some high quality outputs, and it is important to show how you're on a trajectory and have the commitment to become a future research leader. These average now around £500,000, sometimes up to £1 million. So this is the NIHR investment in our future research leaders. So you have to be very clear about where you're heading and how having this funding can help you. And I've highlighted some key points for you to think about, because there's also funding to help establish collaborations and networks, and also to build research capacity. And quite often people don't take as much advantage of these opportunities as one would expect by linking with the absolute key experts in the field, some international travel placements, having a PhD student, or employing a research assistant on this project. So we would expect some continuity with what you've done before, or you have to justify why you're changing direction. And I think throughout all of this, if you can justify what you're doing, then, and it makes sense, then nothing is really out of remit. It's important to look at the NIHR strategies. There's a strong emphasis on EDI now. There's a question on it normally at the interview. And quite often, they're now expecting a review of current evidence or in the application or plans. For the training, it's important for you to show how you've assessed the skills you have and the ones you need to progress the next stage of your career. So how will this order fast track you to where you want to go? And what do you want to do on the way and when you get there? So how have you assessed your skills gap? And this includes things that people often don't think about. They think about technical research skills, but research leadership, building capacity, supporting people coming behind you, how you communicate for impact, specialist skills for working for public and patient engagement. Quite a few people cost in a leadership course in training, and spread your wings and know who the key people in your field are. As I said, this is taken really seriously by the panel. In terms of host environment, I've highlighted two new statements on the current website. So there is an expectation of your host organisation supporting you and committing to supporting you and providing evidence of how they have done that. So yeah, the track record of the department is important, but it's also a track record for how they maintain a supportive research culture and the principles I've highlighted there. So generic statements not particularly helpful. They need to be personalised for you as an individual and for your research. Is there any matched funding? And some applications now have matched funding for PhD studentship. Is there a commitment that your fellowship funding will be protected? And what's the likelihood of you being offered a substantive post at the end of your fellowship? So, and these are probed in the interview as well as providing evidence. This will have been covered, I think, if you're offered an interview, as I put here, as 10 to 14 people. Currently, they're done online. I think there's consideration as to whether this is going to go back to face-to-face. You have a 5-minute presentation, so you don't have long to make your pitch. You have someone focusing on your project, someone focusing on your training plan, mentorship, your future career aspirations, and a question on PPI, and then questions from the whole panel. I think it's important that the people on the panel, maybe 1 or 2 will be experts in your field, but you have to be able to explain what you're doing, the value of what you're doing to people who are not experts in your field. So interview prep is crucial. You need to be with people who are not in your field. You need to do them to have time for feedback on your slides. And in the actual interview, there's nothing more irritating than someone who is overconfident and arrogant. And it's quite a difficult balance because everyone is nervous. But don't get defensive. And I know it's hard to say, but I guess what you're demonstrating is a future, and what I'm looking for is a future research leader in front of them. who's enthusiastic and knowledgeable about a topic and engages in a conversation. So, key points in the interview: you have to tell us why you need this fellowship. You have to answer the question about where you see yourself in the future. It's a very common question. Where do you see yourself in 5 years' time? Where do you be sitting? What kind of group you'd be sitting with? And you need to have thought that through, because some people can be under-ambitious and some people can be over-ambitious. So talk to everyone, talk to people outside your institution, talk to people who are experts in your field. You don't have to move institutions, but it is helpful to have, and I think really important to have people from outside of your who's on your PhD team, and bring in people from other disciplines. You may need statisticians, you may need qualitative or review experts, you may need people from other disciplines working in your field, and that's all important. I put a couple of slides up here of resources for PPI, very often neglected applications. Webinars are available on NIHR. I put a slide up there and the links to the Advanced Fellowship Guidance, and there's a blog by the chair of the panel. So I'm going to stop sharing at that point. The whistle stop tour.
Thank you very much indeed for those insights. As we said at the start, we'll be sharing the recording and the slides from today, so you'll be able to access any of those links and recommendations at a later point. Thanks very much for that. In the final talk of today, I'd like to give a brief overview of the support that's available from the NIHR for fellowship applicants. Can I just check you can see those slides?
Yep.
I'm going to go into slideshow. Great. So, as you may have heard or read, we're at a transition point. The current NIHR Research Design Service, the RDS, will be replaced by a new NIHR Research Support Service, the new RSS, on the 1st of October this year. So to say a little bit about RDS, we're operating business as usual until the 30th of September, so there's still time for you to approach us to discuss your support needs. The RDS has been granted a 6-month extension until the end of March 2024, so we do have time to continue working with applicants and on their projects until they submit or support's no longer required, or we can transfer you across to the most relevant RSS. Just a little bit about the support from RDS. We can advise you on study design and use of suitable research methods. We're big advocates of public involvement. We can facilitate PPI activities and advise on how to get the most from your meetings with members of the public. We can support you working collaboratively, reviewing and suggesting members of your supervisory team and mentors. We can help you get the narrative right, so making sure you're expressing how your research will prove to be beneficial to patients and the NHS and care. And we can also link you with other parts of the research infrastructure, whether that be a suitable trials unit, parts of the clinical research network, or charities for PPI members, etc. A few more specifics on that. We will help you, as you saw from Gareth's presentation, getting your study within remit of the scheme you're targeting is one of the key hurdles to get over. We can help you with checking that your study is in and that you're addressing the funding criteria. Always really important to keep referring back to the guidance. We're very familiar with the guidance that the NIHR has set, and we can help you work through that as well. Help you set and refine your research question, aims and objectives so they're nice and clear. You've heard about the importance of describing your project for a broad audience, and often the first port of call will be for reviewers to read the lay summary. We can help you with those. We have a lay panel of reviewers. It's often the first call and can set the tone for the rest of the application, so it's really important to get that section well crafted. Have you demonstrated the importance and need for the study? Again, people who are reviewing your application won't necessarily be experts in your field, so it's good to be able to describe the importance for a broad audience. We can help you with all aspects of study design, whether that be a feasibility or pilot study or something more definitive, and whether that requires qualitative, quantitative or mixed methods approaches. We help you consider all aspects of equality, diversity and inclusion as well. As mentioned, help with all aspects of PPI. And as you've also heard, equal weighting is given to the quality of your training plan. We have been able to advise well on training plans and the use of frameworks to get the best out of your fellowship award. And also making partnerships, whether that's with in other institutions or with industry potentially. So a very broad offer of support from the RDS. Just a little bit about the new research support service that will come on stream on the 1st of October. The new RSS will operate nationally. It will offer a virtual service that researchers can access independent of their location. It will be delivered through 8 hubs. Hubs will either respond directly to researchers or direct them to the most appropriate expertise within the RSS within the other hubs. 3 hubs will provide specialist support in public health or social care, so 2 for public health and 1 for social care. And for more details on the new scheme, please visit the NIHR website. There's going to be further information on the capabilities of the RSS and how you'll be able to contact them from the 1st of October within the next couple of weeks, so something ahead of the start of the new RSS scheme. So that's a very brief overview of the new RSS. That brings us to the end of our presentations. It's about 12:30, so we've got plenty of time now to enter the Q&A panel session. If I can ask the speakers of today to join me, we'd like to open up the session to questions. I can see we've had a fabulous number of questions in the chat already. Thanks very much to Gareth and Rosie for your fingers must be hot with all the typing you've done. That's brilliant. I can see there's been some really good engagement already. If people would like to raise a hand to ask a question, then please do so now, and we'll take as many questions as we can. Anybody like to start us off? Gareth, you mentioned a little bit about the charity partnerships. Does that involve an additional review then through the charity partner?
It does, yeah. So the charity partners will get an opportunity to review them, especially if there's multiple applications, to decide on the ones which they can support, but it doesn't have any impact on the funding decision that we make. So if the charity chose not to support the funded, we would still fund it 100% from the NIHR. But it does involve an additional review, but just to make sure it's within their remit and it's what they're after.
Thank you, that's great. Thomas, I can see you've got your hand up. Would you like to come in?
Yes, sorry, you might have mentioned this earlier. I missed the first few minutes of the presentation. I'm interested in putting together a fellowship application that involves some technical aspects of artificial intelligence, and I'm a clinician. And that sort of follows on from my PhD, but when it's something very technical that I wouldn't have the skills to do myself, and I wouldn't particularly want to do myself either, but it's going to need quite a lot of work in a technical discipline like computer science, would that be best addressed by putting in funding for something like research assistant or a postdoc, or would that best addressed with collaboration?
I think either, to be honest. So there's an opportunity to put to cost support staff as part of your advanced fellowship application. And if you feel like you'd need sort of support and oversight from a mentor in that area, then you can include one of those as part of the application as well. So I think both, either, whichever one feels like it fully supports what you're trying to achieve through the fellowship.
Thank you. Thanks, Tom, for your question. Gareth, you mentioned you'd like to see more methodology applications. Can you say a little bit more about those? Is there any particular areas you'd like to attract proposals from, or a broad ask?
I think it's just a broad ask, really, to call that out, because I think sometimes there's confusion as to whether we'll fund applications in that area at all. And I think it's important to just, when we get the opportunity to talk about this stuff, to say, yes, we do, and from any area of methodology would be considered. And I expect that we will get these applications as we get involved with parts of the NIHR, like the methodology incubator, and we've funded sort of a few cohorts of pre-doctoral fellowships now who are specifically focused on methodology. We're starting to see that trickle through into doctoral level. So I think as these methodologists come through the system, I think it's just us being clear with our message that we'll fund that research at postdoc level too.
Yeah. And the same for medical education. I think that's something else you mentioned. I wonder how people fare with those and whether they actually express patient benefit well, rather than having a suitable endpoint outcome for those. I don't know if Jane perhaps has a few thoughts on that as well.
Yeah, we have had some methods ones. There is there's some highlight called coming up, isn't there soon, Gareth? Methodologists. You do have to demonstrate where this is going to have benefit for patients of health systems. And sort of make your case, really, with a realistic assessment of what stages are to make that happen and how long the time plan is. I think quite a common where I've seen people get grilled is around the use of big data and AI and some over-optimistic statements about availability and quality of the data, how long it will take to link with they have someone with the skills to link it. So I think it's about being realistic, how long it will take to get permission, all the safe data hub is. I think that is where I have seen some people grilled and that type of analysis that they're going to do.
Thank you. Rhiannon, would you like to come in and ask your question?
Hi, thanks. Yeah, I was just interested. A lot of the examples that we've heard seem to be quite based in clinical practice, and my proposal is very much based on social determinants and very broad, really straddling health and social care and education. And I suppose I, feel very strongly that it's very linked to health, but I'd have to work quite hard to make that case clearly. So I suppose I'm just interested in your view on all that and whether it's still appropriate to base it within NIHR, given all the talk we hear about, fragmentation and the need for more joining up. I don't know if you have any views.
I think my view would be that it sounds completely relevant for what we're trying to do. I think that sort of space across health and social care is becoming increasingly relevant, and I think we're starting to see more and more applications that not only transition into sort of a social care space, but are focused on the wider determinants of health, especially. So I think for us, it's definitely within remit. It's just a case of you telling us why there's benefits for patients and the public. And I think there's a really clear case to be made. And I think we know that we're receiving more applications in this area, and we're defining the membership of our committees so that they can be able to assess these fairly and robustly like they can applications that are a bit more clinical focused. So my opinion is yes, please send the application in.
Thanks.
Can I add on the panel I sit on, I would say 30% of the people, if not more, methodologists of various types, including social scientists, and don't forget to align it with current policy and strategic research priorities that are on the DHSC website, and inequalities and the social determinants, social and structural determinants of health are right up front there. But it's how would the new knowledge from your research then help us tackle these issues?
Really helpful. Thanks very much.
Thank you. Gareth, can you say something about maybe the success rates for the schemes, for getting through to an interview and then from the interview to getting funded?
Yeah, I would suggest it's somewhere around the 20 to 25% mark if you consider the full cohort of people that apply at the very start when we check for eligibility to the number of people that we fund at the end of a round. I think we would, if we received somewhere in the realms of 60 to 70 applications in a round, we're trying to fund around 15 or so by the end of it. And we've actually got a strategic requirement now to fund more advanced fellowships. We've got additional funding over the next few years as part of a comprehensive spending review to take the number we fund each year up by 5 or 6, depending on sort of the average cost that comes across. So yeah, I think we want more applications from different people in different backgrounds, and we have the facility to fund them. So the success rate, I think, and I normally do ask when I go out to do postgraduate presentations to see if people know, and the success rate figure I get quoted back is normally substantially lower than the reality. So I think by the time you attend interview, you're looking at around over 50% chance success rate in the cohort.
Can I just add to that? Because that's sort of fixing the advanced panel. We have specific instructions as a panel to look at the person, look at their potential, and not be a panel that is looking for every minor fault that might be in an application and knock them out of to get to an interview at those panels. People are pretty good and have achieved a huge amount already. So we're certainly being encouraged to think, well, Are there practical things? Is there practical feedback that we will make this a fundable application? So the kind of culture of the panel is supportive and wanting to see people succeed.
Great, thank you. Thanks for that. Thomas, do you have another question?
Just another 2 quick questions, actually. One is,
Go for it.
does the amount of money you apply for affect your likelihood of success? Is it better to try and minimise that amount? And the second question is, if a hospital is willing to pay some time for clinical work, you mentioned that it can be done less than full time. Does that mean you could, for example, do a 5-year fellowship over 10 years at 50%? It seems like a really long time. Or is that, it seems like a better option because then you'd have 10 years of funding?
So it's a good question. I think they are assessed for value for money, but lower cost applications don't have a higher success rate than higher cost applications. So long as you can justify whatever it is you've costed in your budget, I don't think it matters the total cost. And to speak quite candidly, they're going up every round on average, generally speaking. I think this last round is the first round during my time at the NIHR that the average value of a fellowship at advanced level has been over £1 million. So they are getting substantially more expensive, I think. And then as for your second question, you could, yes, we have funded someone to do a 50% fellowship over 10 years. There's a slight caveat in that process that they'll be expected to come in and sort of not re-review the application, but sort of re-justify and to make sure that it's still relevant at checkpoints within the fellowship, because things can change pretty dramatically over the course of 10 years. So while it is guaranteed funding for 10 years, we would expect the research to still be relevant. So there would be check-in points throughout that to make sure that it's still appropriate.
Thank you. Kate.
Thanks.
Just in response to Thomas's comment about kind of trying to stretch it over part-time, I attempted to do that as well in terms of my costings, but the overheads from the university kind of really made it all stack up over that time period. And I ended up actually not being able to apply for even a full-time fellowship for the 5 years, and ended up needing to use keep my clinical time, keep my clinical salary, because again, yeah, I stupidly didn't add in the overheads, and suddenly I was another £800,000 added onto the cost. So needed to be strategic about that. And the other thing that I did, which was really helpful, was actually to cost for my support staff through, if it's possible, through the hospital, because then you don't have the overheads. And I maybe shouldn't be saying this publicly, I don't know, but definitely that meant that it was I could stretch the money or forecast money kind of further.
Thank you. Thanks for that. Any more questions? I think you probably asked most during the talks. I can't see anyone else with their hand up. Let's check we haven't missed any in the chat. This is your final call for questions. No? Okay. Well, it's been a fabulous session. Thanks to all our presenters today. Really useful insights into developing an application and how to apply and what to focus on. So that's been a really, really useful session. As we mentioned at the start, we've recorded this. It'll take us a few days just to tidy it up and get it out to you, but that should be a suitable reference for you to come back to. Do sign up with the RDS if you're in that position, and look out for more information on the new RSS when it becomes available. So thanks everyone for joining. Thanks to all the presenters again. Have a really good afternoon and good luck with those fellowship applications. I'll say goodbye.
Thanks everyone.
Cheers,
Peter. Cheers.